Hello, welcome to Diabetes 101 from MyDiabetesHome.com, where you will learn all you need to know about diabetes. We're going to review the basic facts about diabetes and help you learn everything you need to know, including what it is, what causes it, the different types of diabetes, the symptoms of diabetes, how doctors diagnose diabetes, the importance of checking blood sugar, and how to treat your diabetes. Let's get started. Diabetes is the condition that occurs when your body is not able to properly store and use glucose, which is a form of sugar, from digested food. This results in blood sugar levels that are too high, which can cause problems throughout your body. There are two main kinds of diabetes: type 1 diabetes, which is sometimes called insulin-dependent diabetes, and type 2 diabetes, which is sometimes called non-insulin dependent diabetes. Normally, insulin flows from your pancreas into your bloodstream to control your blood glucose. Think of insulin as the key that unlocks your body's cells to let glucose inside. Just like your car needs gas to run, your cells need glucose to function. Without any insulin in your body, your cells would starve and you would not be able to live. If you have type 1 diabetes, your pancreas cannot make any insulin at all, so there is no more insulin in your body. So what causes people to develop type 1 diabetes? Experts are still not exactly sure, but there appears to be a genetic link within families and possibly a trigger, such as a virus or certain chemicals, that can cause your immune system to attack your pancreas and prevent it from making insulin. If you've been told you have type 2 diabetes, your body is not making enough insulin, and the cells in your body are resistant to its effects. Type 2 diabetes occurs when your body and cells become resistant to the effects of insulin as a result of the combined effects of genetic risks and lifestyle choices, such as carrying extra weight and being sedentary. As your age goes up, so does your risk for type 2 diabetes. You may already know how you feel when your blood sugar is too high. Some diabetes symptoms can include the urge to urinate frequently, losing weight quickly, or being constantly hungry or thirsty. An easy way to remember the symptoms of diabetes is by spelling the word diabetes. D stands for delayed healing, I stands for impotence, A stands for a change in weight, B stands for blurred vision, E stands for excessive urination, T stands for thirst, E stands for extreme fatigue, and S stands for skin infections. If you have type 2 diabetes, you may have other symptoms that can be easily confused with common everyday experiences, such as low energy, poor sleep, trouble with your vision, or headaches. Listen to our diabetes educator talk about the symptoms commonly heard from patients.
Today we're talking with Emily Graham, who's a certified diabetes educator and a nutritionist. And we're just wondering, Emily, what are the usual symptoms that people complain to you about when they're first diagnosed with diabetes?
When people first get diagnosed, I have actually quite a mix of symptoms that they may feel. Some people may feel that their energy is low, they're tired all the time, they feel as if they are drinking a lot more than they usually have, or they're up during the night multiple times just going to the bathroom. Some just feel really symptomatic with those type of things. And on the other hand, I have another group of patients who have no symptoms at all. They complain of none of those, and just the diagnosis comes as a complete surprise.
Oh, and a shock to some people, I'm sure.
Definitely. They don't even think they have it because they felt no different for the past few years. They just thought, this is how I am. This is how my life is.
I see.
You may have avoided going to the doctor and ignored your symptoms for a while. After all, not many people like the thought of anyone poking and prodding them, taking their blood, and telling them scary things about their health. Here are some other reasons patients delay seeing a doctor.
So today I'm here with Dr. Anuj Bhargava, who's one of our endocrinologists here at the Iowa Diabetes and Endocrinology Center. And a question I wanted to ask you is, why do people delay for so long seeing a physician?
June, you bring up a very good and important question. And the reason I think is because diabetes is so different. If I have knee pain, I'm hurting every day, I'm going to go to the doctor. I have a sore throat and a bad infection and high fever, I'm going to go to the doctor. The problem with diseases like diabetes, heart disease, blood pressure is symptoms come late and way too late. Too much urination, very thirsty, losing weight. Well, sugars have to be 200s and 300s to do that. So the problem is diabetes doesn't hurt, at least in the beginning. Later, when people delay their treatment for a long time, it does hurt in many different ways. I wish people came to their regular doctors much earlier and regularly every 3 months and when needed to the specialists like us to get their treatment for diabetes.
At a doctor visit, your doctor will do a physical exam, ask about your medical and family history, ask about your symptoms, and take some blood samples to test in the lab. One of the following blood tests means a diabetes diagnosis. Your fasting blood glucose, taken before breakfast or 8 hours since your last meal, was 126 or higher. Your non-fasting blood glucose was 200 or higher. Your blood A1C was 6.5% or higher. Sorry, we're throwing all of these new terms at you. The A1C test measures your average blood glucose levels over the past 3 months. The A1C test is checked in your doctor's office when you are first diagnosed, and also regularly during your follow-up doctor visits.
So when your blood tests come back abnormal, your doctor is going to recheck those a second time just to be absolutely sure that you do have diabetes. So you've gotten a repeat test and now you find out that yes, those tests are abnormal too. And so now you really do have a diagnosis of diabetes. So obviously you didn't want to hear that, but now you have information to arm you with knowledge about why you've been having these symptoms and even more importantly, what you can do about it. So I like to tell patients that it's kind of a backhanded gift to have a diagnosis of diabetes. Yes, it does sting a little bit at first, but as you get familiar with what to do with it, you're going to be able to have a much better life and a much healthier life.
Your doctor may have told you to start checking your blood glucose at home with a glucose meter. You will need to poke your finger with a lancet to get a tiny drop of blood to apply to a test strip that inserts into the meter. Your blood glucose result will appear on the meter's screen. I know the idea of poking yourself can be very scary, but checking your own blood sugar on a regular basis is very important. Doctors ask you to check your blood glucose regularly because if you know what your blood glucose results are and they're too high, you can do something about it. Without these results, you have no idea what your blood glucose is at any moment and what to do. Keeping your blood glucose as close to normal as possible means you keep your eyes, nerves, kidneys, legs, feet, and heart healthy.
So when it comes to testing your blood sugar, I like to ask my patients this question. So would you ever drive on the expressway at rush hour going 80 miles an hour with your windows painted black? Well, of course not. You would hurt other people and you would hurt yourself. Well, it's the same thing about checking your blood glucose. Driving blind is exactly the same thing when you're not checking your blood glucose. So if you can check your blood sugars, you know where you're going and you're much less likely to get hurt.
Having diabetes may put you at a higher risk for having a heart attack or stroke, and you are twice as likely to have heart problems. These problems do not have to happen to you. If you get control of your diabetes, you do not have to go down this path, and if you control your blood pressure and cholesterol, you'll protect your heart health. Your doctor will regularly check your blood pressure and cholesterol to be sure they are normal. Think about your blood glucose and A1C as being healthy targets you want to hit, like a bullseye. Your fasting blood glucose readings, when you've had no food for at least 8 hours, should be in the range of 80 to 130 on your glucose meter. Your after-meal glucose readings, about 2 hours after eating, should be less than 140 to 180 on your glucose meter. Your A1C in the doctor's office should be less than 7%, but this goal could be slightly lower or slightly higher, depending on what your doctor thinks is best for you.
Hello, my name is Emily Graham and I'm one of the diabetes educators for My Diabetes Home, and today I want to show you how to actually test a blood sugar, because when you are diagnosed with diabetes, this is one thing that your doctor is going to ask you to do. And this is so important because when having diabetes you have high blood sugars, and we want to figure out when are those high blood sugars happening. So there's multiple times that you can actually test a blood sugar. Your doctor may ask you to test first thing in the morning just to see how your blood sugars are without the impact of food, and they may ask you to test after a meal. It could be between 1 to 2 hours after you eat, and they may also want to have you check at bedtime, just so you can see as you go through all the day's stresses and all the food that you've had and activity, kind of where you end your day. Plus that really gives you an idea to see what's happening during the night from bedtime to fasting. So I'm going to walk you through how to actually test a blood sugar. So of course we want you to wash your hands, get rid of any food particles, lotion, and since I don't have a sink available today, we're going to use an alcohol swab. So I'm just going to wipe off one of my fingers, just make sure it's nice and clean. I'm going to let that dry so it doesn't sting. And I'm going to grab out a strip. And you just want to make sure that your strip matches whatever meter you're using. Place your strip in your meter. That should be dry. I'm going to go ahead and poke. And hopefully I'll get some blood out of this. Nope, I didn't, so I'm going to retry. There we go. That should work. You just want to get a little sample. And then I'm going to go ahead and touch it right to the strip. And it beeps, and I just got to wait a couple seconds and see where I'm at. All right, and now I know how my body responded to my lunch today.
Now, on a given day, you may find that your blood glucose readings are not always in the perfect target range. The best thing for your health is to make sure the majority of your glucose readings are in that range. Let's talk a little bit about living your life. You may have attended a holiday gathering where sugary desserts were everywhere, or went a little crazy over the cake and ice cream at a family member's birthday party. Those things are a normal part of life. By the way, it is the sugars, starches, and fiber, all called carbohydrates or carbs in foods, that raise your blood sugar the most. The challenge for you is to get back on your healthy path and stay there most of the time. Don't worry, we'll provide more healthy meal planning tips in a future class. Let's review our journey so far. You know what diabetes is, what causes it, what symptoms can occur, how it's diagnosed, why checking your blood glucose is important, healthy targets for your blood glucose, and how to check your blood glucose at home. Now we're going to talk about the tools you have to control your blood glucose and keep your diabetes under good control so you can have a healthy life. Let's talk about building a strong foundation for a healthy life. Imagine that you're in charge of constructing a building. Would you build the top floors first and the foundation last? Of course not. Think about making healthier food choices and staying in motion as the foundation for your building. Now the building, or your body in this case, is built to last. Building a strong foundation for health means avoiding high-sugar foods, watching your portions, eating whole foods and whole grains, and staying active. These are all essential for maintaining a healthy body and a healthy life. We'll provide more details for healthy living in future classes. If you build a strong foundation and your blood sugar still isn't the healthiest it can be, now what? That's where diabetes medicine comes in. If you have type 1 diabetes, you just continue to focus mostly on making adjustments to your insulin. But if you have type 2 diabetes, there are more options. There are many medications to help treat type 2 diabetes. Some of these treatments are pills you swallow daily, and some are injections that you inject into the outer layer of your skin. Your doctor may even want you to use both pills and injections to help you better control your diabetes. What medications you take depends on what you need and want. Keep in mind that none of these medications will cure your diabetes. Medications keep your diabetes under control, which means you'll need to take them on a lifelong basis. Lots of research is going on to look for a cure, but for now, keep taking those medications.
I'm Dr. Bhargava, endocrinologist from My Diabetes Home, and today I have with me Dr. June Johnson, pharmacist, professor at Drake University. Very happy to have you here.
It's good to be here.
So June, here's a question that bothers me a lot. I see a lot of patients with diabetes, and they're on multiple medicines, and the struggle with the cost is such a huge problem for them. So hopefully with your background, you could tell us some tips that would help our patients afford their medications better.
That's a great issue, and it's a major issue for people not being able to take their medicines. And it's an understandable concern. I mean, some people have to make a decision between paying for a medication and being able to afford their meals, their food.
Yes.
So some of the tips that I can give people is if there is a generic available, oftentimes that will reduce the cost dramatically. So there's many programs out there that are a $4 generic that are very affordable. And so some of the pills that we have for diabetes have very affordable generic forms available. So that's something to bring up at your doctor visit and ask your doctor about. The most expensive medications tend to be those that are just approved, brand new, or they're injectable, or they're a special kind of a formulation. In those cases, you may want to ask your doctor if they have any samples in the office. Oftentimes, the pharmaceutical companies use that as a way to start people off on their medications.
Samples.
And so samples, are definitely helpful. Look at the co-pays that your insurance company has, and sometimes you have to be a little proactive and call your insurance company and ask them what the co-pays are for different levels of medications, and sometimes you can get a better co-pay if you can kind of compare.
So in a class of medicine, there could be different tiers, 1, 2, 3.
Absolutely.
If yours is tier 3 and you're paying $45 a month,
Right.
look at your formulary, the medicine, and see if there's a $25 alternative.
Absolutely.
So knowing the copay on the insurance. Great.
Absolutely. And then talk to your doctor about many of the pharmaceutical companies offer programs where they may provide you with a card. It looks like a credit card or a voucher of some kind, and that might be able to get you 1, 2, 3 months free of medication or even longer. So you do have to be proactive and bring this up during the doctor visit so that you can have a conversation with your doctor about that.
Now, for cash pay patients, there may be discount cards like drug discount card. MedSimple medication management platform has a drug discount card, so that can be used for patients. And also, it's very hard to keep up with all these different options available: the generics, the tiers, the prescription assistance programs. So one tip from my side would be for patients to use MedSimple, which allows patients to look at all those different options and know all money-saving options.
And then one other thing I do want to talk to you about a little bit is, people get worried about low blood sugar sometimes on certain medications they're on called hypoglycemia. Are there certain medicines that are more or less likely to be associated with too low of a blood sugar?
Yes, this is an important topic for patients with diabetes, and they need to know which medicines can cause low and which ones cannot. So now it's a little bit easier. So insulins, they can cause hypoglycemia or low sugar reaction. That's one for sure. The other important class that's widely used is what's called the sulfonylurea. And these medicines start with the word G: glipizide, glimepiride, glyburide. These are the other medicines that can cause hypoglycemia. Apart from that, other medicines, it's pretty rare for them to cause hypoglycemia. There are Starlix and Prandin that can cause hypoglycemia, but they're used very little now. Rarely, metformin or glucophage can occasionally cause hypoglycemia. It's very uncommon. And metformin, as you know, is our mainstay of diabetes, so we keep people on that. But you're right, patients need to know which medicines cause low sugars and which ones don't.
Okay.
And my goal always is to put people on things that do not cause hypoglycemia.
Right. And then one last question is, people are always looking for something that's a little bit more convenient to help them to remember and stay on track taking their medicines. Are there some things available for weekly use now instead of every single day?
Things are changing, and each new thing we see is better in some ways. So yes, now there are these medicines which are called GLP-1, Byetta, Victoza, Bydureon, and there are 2 more in the class. The Bydureon is once a week, so the patient has to take it once a week. And I think we'll see more of these things happening in future where the frequency is lesser so that the patient doesn't have to think about the medicine on a daily basis.
That's good. Very helpful. Thank you so much.
Some pills, such as metformin, work by lessening the amount of glucose your liver makes and making your cells more sensitive to insulin. Other pills work by increasing the amount of insulin your pancreas can make and put into your blood. Newer medicines can slow down how quickly your body absorbs glucose or can increase the amount of glucose your kidneys put into your urine. If you hate shots and are afraid of needles, you're not alone. But many people find that these medicines really help them to better meet their glucose targets, and once they get used to giving themselves an injection, it's quick and easy to do. There are non-insulin injectable medicines that can act in a number of ways. These include slowing down how quickly your body absorbs glucose, increasing the amount of insulin your pancreas puts out, and reducing your appetite. Taking an injectable medicine gets easier over time, we promise. With a little practice and guidance from your provider or diabetes educator, you'll be confident and comfortable giving yourself an injection.
With any of these medications, it's important to be aware that there are some adverse side effects that are associated with some of them. Now, unfortunately, none of them are a magic bullet. They do good things for your blood sugar, but sometimes there's some side effects. It really depends on the type of medicine that you're taking. So for example, if you're on a medicine that squeezes that tube of toothpaste, it squeezes that pancreas to let out more insulin, you may be at higher risk for low blood sugar. Or if you're on one of these new incretin mimetics that we talked about, some of those tend to cause a little nausea when patients first start them. Your reaction to a medicine and your likelihood to get side effects is a very individual situation. And oftentimes, if you're having problems and you talk that over with your doctor, they can make adjustments in the dose and even the choice of the medicine to reduce those side effects.
Let's talk about insulin. Has your doctor talked to you about using insulin and what it is exactly? Insulin is a hormone that your pancreas normally makes to keep your blood glucose under control. If you have type 1 diabetes, your pancreas doesn't make any insulin. And if you have type 2 diabetes, your body may not make enough insulin or may not be sensitive to the effects of insulin. In these cases, you may need to inject insulin every day through a short needle into the outer layer of skin on your stomach, arm, thigh, or buttocks to keep your blood glucose levels under good control. Insulin is required if you have type 1 diabetes. If you have type 2 diabetes, the timing of when to start insulin depends on how well other medicines are working and how high your blood glucose is. Some people inject their insulin by drawing up insulin from a vial with an insulin syringe. You may prefer an insulin pen that is pre-filled with insulin, or even an insulin pump that gives you continuous insulin. This is what insulin vials, insulin pens, and an insulin pump all look like.
My name is Emily Graham, and I'm one of the diabetes educators for My Diabetes Home. And today I wanted to show you 2 different ways to administer insulin. So when insulin is needed as part of your plan, your doctor may either recommend an insulin pen or an insulin vial and syringe. So to work an insulin pen, these are really slick because you take off the cap and it's already preloaded with your insulin. So all you have to do is take some rubbing alcohol, and you want to clean the top part of that pen off. And then you're going to grab your pen needle, and what we're going to do here is once that paper is off, we're going to stab it on the top to give it a little twist, and once it feels nice and snug, we're going to go ahead and take off this outer cap and this color cap, which protects the needle. And then on the side here, we're going to decide where or how much insulin you're going to take. So your doctor will give you that recommendation, so let's just pretend you need to take 10 units. You're then going to dial the pen all the way to 10. All right, and I'm there. So then once you have your pen dialed, what you want to do is decide where you want to put this insulin. So the best place to go would be fatty tissue. So a lot of people like their abdomen. You can also do your outer thighs and also the back part of your arm. So once you have your site collected and cleaned, what you'll do is you grab the pen with your forefingers, and then you're going to insert the pen directly into the tissue. And then with your thumb, you want to press nice and easy until that 10 goes all the way down to 0. And once it hits the 0 mark, you want to hold it there for about 5 to 10 seconds to make sure you get every drop, and then you're going to pull it right out. Then to remove that needle, you want to put your cap directly over it, and you're just going to turn the opposite way to get that needle off. And these are designed to use just once, so you want to put this in a hard plastic container once you're done. So that's the insulin pen. Now the vial and syringe is a little different, but just as easy to do. You still need some rubbing alcohol, because what you want to do is clean the top part of that vial off. And then you're going to grab your syringe, you're going to take off this little plunger, and you're going to take off your orange cap. So if we pretend we still need to take the 10 units of insulin, you're then going to pull down on this plunger all the way down until the top part of that black plunger is lined up with 10. Then you're going to take that dose in air, you're going to insert that needle directly in the center of that vial. Now you want to hold it nice and steady because you don't want to bend that needle. And then what you're going to do is you're going to push with the plunger that air into the vial. And that helps create some pressure. Then after that, you want to go ahead and pull back down to 10. And if you see a bubble or two, or if you don't like what you drew out, you can always push it back in and try again down to 10. Once you have your dose, you're going to then flip it in the right direction, take out your needle, and then you're going to find wherever you want to put your insulin, put the needle directly into the tissue, and then with your finger here, you're just going to slowly inject the insulin into the area. Still hold it there for about 5 to 10 seconds, and then you're good to take it out. And then this can get thrown away in a Sharps container or any hard plastic container you have at home.
Let's talk about insulin and low blood sugar. You have to keep track of your blood glucose very carefully when you start insulin, since it can sometimes cause your blood glucose to drop too quickly or drop too low. This is called hypoglycemia, and it will appear on your glucose meter as a reading less than 70. You may feel symptoms of hypoglycemia such as feeling shaky, sweaty, weak, or experiencing a fast heartbeat, or a headache when your blood glucose is too low. You also may be cranky or irritable. You need to treat your hypoglycemia with a fast source of high sugar food or beverage and aim for eating about 15 grams of glucose. You can do this with items such as chewable glucose tablets or a sugary beverage. You should recheck your blood glucose in about 15 minutes, and if it is still low, you may have to eat more sugary foods or beverages to get your blood sugar back up to normal levels. Chewable glucose tablets, regular soda, and fruit juices are fast sources of sugar. You should always carry sources of glucose with you. Keep some in your car, at work, at home, and any other place where you live or spend time. We'll provide more information on hypoglycemia in a future class. What if you can't treat your low blood glucose on your own? If you have type 1 diabetes, you have an injectable medicine called glucagon on hand so that others can treat you. Your family and friends should be trained on how to give a glucagon injection. Here's an easy checklist for what you need to do every day to keep your diabetes under good control. Check your blood glucose. Take your medicine as prescribed. Make healthy meal choices. Move at least 30 minutes every day, at least 5 days a week. Inspect your feet and footwear, and brush and floss your teeth. Every 3 to 6 months, you'll visit your doctor. Your doctor will check your A1C, your blood pressure, your weight, your feet, and review your blood glucose targets. And once every year, get an eye exam, get a complete physical exam, get a full foot exam, have some blood tests done, such as cholesterol and urine protein, and update your immunizations. So now we are at the end of our first journey together. We hear from patients over and over that they feel so much better when their blood glucose is under good control. You will find that you have more energy, your mood may improve, you'll stop having all those symptoms we talked about from high blood glucose, and you'll be preserving your eyes, nerves, kidneys, and heart. Millions of people are successful at controlling their diabetes. Why not you? Thanks for taking this class. We hope you found the information useful. We want you to live a life without limits and feel more confident in living a healthy life with diabetes.